Hi, my name is Ishmael Coto, and I'm a registered nurse here at the Cardiac Cath Lab at the Brooklyn Hospital Center, and I'm here to discuss what you need to know about congestive heart failure. Now, before we learn about CHF, we need to learn about the anatomy of a healthy heart. The normal heart is a fist-sized pump made of muscular tissue. The heart has four chambers. You have two upper chambers known as the atria, the right atria and the left atria, and then you have two bottom ventricles, the right ventricle and the left ventricle. The cycle begins when non-oxygenated blood returns to the heart from the veins into the right atrium. This non-oxygenated blood then goes into the right ventricle and then goes into the lungs where it picks up oxygen and now becomes oxygen-rich blood. This oxygen-rich blood then goes to the left atrium, to the left ventricle. It is now ready to be pumped out to the rest of the body. Now, what is CHF? Congestive heart failure, also known as CHF, is a chronic progressive condition that affects the pumping power of your heart muscle. It is when the heart can no longer effectively pump blood as it once could. There are a number of risk factors that can lead to heart failure, but essentially it is due to the heart muscle has become too weak to pump blood effectively to the rest of the body and its organs, or the walls of the heart have become too stiff, leading to ineffective filling of blood in the heart's chambers. What causes CHF? As we get older, the heart naturally loses its effectiveness to pump blood, but there are other health conditions that, if not managed properly, can make it worse. Coronary artery disease. The buildup of cholesterol and plaque in the arteries thin these walls, depriving the heart of the necessary oxygen-rich blood that it needs. When this occurs, one can begin to feel that chest pain, and if left untreated, it can lead to a heart attack. This can lead to damage of the walls of the heart, making it less effective at filling or pumping blood. And you see the heart attacks. If you hear STEMI or NSTEMI, that's all part of heart attacks. Hypertension, high blood pressure. Hypertension makes the heart work harder in order to keep the blood circulating throughout your body. From working too hard, eventually the heart can become fatigued and weak. The heart walls can also become stiffer. These stiffer walls prevent the ventricle from filling with as much blood as it once did. You can also see valvular disease, and let's touch on congenital heart defects. Faulty heart valves and congenital heart defects. The valves inside the heart, you have the mitral, tricuspid, aortic, and pulmonic, can be faulty. Example, mitral regurgitation. Or there can be thickening of these valvular walls, such as aortic stenosis. These valvular issues cause ineffective blood filling and flow. One can also be born with deficiencies of these heart valves and chambers, causing the fully formed areas to work harder, eventually leading to heart failure. Kidney disease is also another cause of CHF, as is diabetes. Diabetics tend to have coronary artery disease and hypertension. Smoking, the tobacco, the nicotine causes high blood pressure and faster heart rate, which makes the heart work harder. Drug or alcohol abuse can damage the heart muscle, making the heart work harder. You see what I'm getting at? Infections of the heart. You can have an infection of a heart from viruses, such as COVID-19. It can attack the heart and cause inflammation of the heart muscle, called myocarditis, which again leads to the heart having to pump harder. Thyroid disease and, like we talked about, congenital heart defects. All right. Now, there are a lot of symptoms of CHF. As you see here, shortness of breath or dyspnea. In heart failure, when normal flow of blood becomes strained and when blood is not pumping through the heart as it should be, one may begin to feel symptoms of heart failure. Let's run through some of these more common symptoms. And as we just said, shortness of breath, when the heart can't keep up with the supply of oxygen-rich blood from the lungs to pump out to the body, this blood then backs up and then enters the lungs. This causes fluid inside of the lungs, causing that shortness of breath. And you can also have persistent coughing or wheezing with white or pink blood-tinged phlegm. You can also have a constant feeling of fatigue or weakness. Heart failure prevents adequate flow of essential blood to the rest of the body and its organs. The body compensates for this by diverting blood to the more vital organs, the brain and the heart, leaving muscles and other tissues slightly deprived. You can have swelling or edema in your legs, ankles, and feet. When there is a backup of blood in the heart due to its ineffectiveness to pump, the non-oxygenated blood that was to enter the heart now begins to back up. This gives you the swollen legs, the swollen ankles, the swollen feet. It can even go down to the abdomen, causing swollen abdomen, known as ascites. And rapid or irregular heartbeat at rest. When your heart is not pumping as normally as it should, your heart tends to compensate by beating faster. Again, this will eventually tire the heart out. Increased need to urinate at night. Very rapid weight gain from fluid retention. lack of appetite or nausea, difficulty concentrating or decreased alertness, chest pain if your heart failure is caused by a heart attack, or sudden severe shortness of breath, which is emergent and coughing up pink, foamy mucus. Now, if you're having that chest pain or shortness of breath, very important you call 911. This is an emergent situation and you need quick care. Now, there are ways to diagnose CHF. You can get blood tests. Your doctor may want a blood test just to see your lab values. They may want to order a chest x-ray. Now, in a chest x-ray, they're going to be able to see any enlargement of the heart or if there's any fluids inside of the lungs. You may hear echocardiogram. This is where the doctor wants to see an ejection fraction. Normal ejection fraction, or EF, is 50 to 70%. What this tells a doctor is that the blood that is in the left ventricle, 50% to 70% of it is being pumped out to the rest of the body, and that's a normal EF. If your number is lower, then your congestive heart failure is a lot worse. They may want to do an electrocardiogram, also known as an EKG, or cardiac catheterization. You'll come right here to the cardiac cath lab. We'll check those vessels to see if there's any blockages. Again, any blockages can lead to a heart attack, which can damage the heart. Or they may want to order a stress test. Diagnosing CHF, you see on the left side, that's an echo is kind of hard to view, but an echo of a normal EF versus congestive heart failure with a lower EF. You can see on the right side, it's a little more expanded, a little more enlarged. Now, managing CHF. There is no cure for CHF, but there are ways to manage it and continue living a healthy lifestyle. Maintain a low blood pressure. Obtain a home blood pressure monitor. Keep on top of your vital signs. Take your medications as prescribed. If you're on any blood pressure medications, you want to make sure you're taking it and call the doctor before you decide to stop on your own. Especially medications that are known as diuretics or water pills. If you're on Lasix, also known as furosemide, hydrochlorothiazide, these are medications that help get that unnecessary extra fluid out of your body and make you live that healthier lifestyle. So don't stop taking that unless you discuss with your physician. Self-monitor your symptoms as we went through. Maintain fluid balance. Fluid balance, you want to make sure you're not taking too much water, about 1 liter to 1.5 liters of water a day. You want to check with your physician. Schedule regular checkups in cardiology so you know the game plan. Exercise regularly and limit salt or sodium intake. Sodium tends to retain fluid. So when you have CHF, your body is already overloaded with too much fluid. You can get fluid in your lungs. You have all this extra fluid that is having difficulty getting out of your body. So you want to make sure you're not putting too much sodium and too much fluid back into your body. Read the labels on packaged foods, avoid fast foods, choose foods that are low in salt or sodium, less than 1,500 milligrams daily is the recommended amount. Eat fresh fruits, vegetables, fish, poultry, and meats. Avoid canned foods when possible. Choose plain rice, oatmeal, and pastas as an alternative to pre-seasoned options. Season food with more herbs and spices as alternatives for flavoring, and see a nutritionist if needed to help with options. The future of managing CHF, CardioMEMS, which is a procedure we do here at the Cardiac Cath Lab. The CardioMEMS heart failure system is a one-of-a-kind remote monitoring technology. It detects changes in the pulmonary artery pressure, which gives the physician an early indicator of worsening heart failure. This technology provides alerts to the physician relating to the worsening of a patient's heart failure, which is transmitted then to that cardiologist, and that cardiologist then has actionable data that can be used to intervene before a patient feels these symptoms. So it's a sensor via right heart catheterization inserted to the pulmonary artery. The patient is able to go home, lay on this device, as you see in the second picture there, like a pillow. They lay on top of it, follow the instructions. About 2 minutes later, they send that information to the doctor. Now the doctor has information and can intervene and discuss further plan as necessary with the patient. Tips to preventing CHF. Commit to healthy lifestyle changes, including the following. Control high blood pressure, cholesterol levels, and diabetes. Reach or maintain a healthy weight. Quit smoking and chewing tobacco. Limit alcohol intake and exercise regularly. And we're here to help you. To make an appointment with the Brooklyn Hospital Center's cardiology department, please contact 718-250-8627. And you can see a list of our amazing cardiologists at the bottom, and they are located at the Physicians Pavilion on the 9th floor, 86 St. Felix Street, Brooklyn, New York, 11217, Monday to Friday, 9 to 5. And we're here to help you. Please leave your messages, questions, comments here on this link, and we will respond to you. Thank you so much for watching. Stay healthy, stay safe, and we're here to help you. Thank you.